microfinance development. He holds a master's in management from Northwestern University's Kellogg's Graduate School of Management and an undergrad degree from Harvard University. George's experience brings together medicine's access, partnerships, country implementation, private sector engagement, and health systems, all of which are highly relevant to today's discussion. George, thank you for being with us today. We welcome you.
Thank
So,
you.
everyone, yeah, thank you so much. So, everyone, a key question for today is how do we ensure that innovation actually reaches the people who need it? I now welcome Professor Lalwani to begin with our main discussion and explore the core theme from discovery to patient, how medicines save lives. Over to you, Prof.
All right, excellent. Every time George gets introduced, I feel so diminished. I mean, what a background and what a close friend. George, great to have you again. Thank you, Luca and Shamli, for that wonderful introductions for all of us. So, George, we've known each other for more than 20 years, and I really wanted to bring you to this platform to share your experiences, and especially that you come from a rather unique non-health background, but you're in health. But before we go into those details, could you just lay out your background? You've lived in multiple countries, different, both in terms of your cultural background, your academic background, your work background is all over the world. Please just share your story, share your experiences. Over to you.
Yeah, thank you. Thank you very much. And yes, I'm very happy to be here with this group. I have to say I'm conscious looking at the participants coming into this call, and then what was just flashed up as my background. It might seem like we're coming at these questions from very different places. I was born in the United States. I studied in the United States. I had the luck of being able to get an international job in Mozambique. So I want to be sensitive to the fact that my experience is my experience. I'm not, none of this is a universal roadmap, but I do think there are things that have helped guide me that hopefully can be relevant for the group today. So I'm really excited about that. Quick question logistically. I have seen people asking about French. So I don't know if we need to let people know is or is there not a French translation option. If not, then they should just be aware.
Luca, normally we have different
Is
ones.
there
These
an
are done
option,
in
or
English.
otherwise we just let people know that we can.
I don't think for this session, Paul.
All right.
Okay, simultaneous.
So-
Just check the Zoom features. It may be there. I don't know. Okay.
Yeah, we'll also provide the recording anyway with a transcript. So if any
Great.
Oh, good.
of you guys
That
have
could be
doubts on
cleared
that in
later.
the chat,
All right.
I already saw a couple questions that
But-
we'll
so-
be providing you guys with the
But
recordings.
this
And
is-
there's also a YouTube live
yeah,
stream with
yeah, yeah.
subtitles.
So the only French I'll say today is on s'excuse that we're not doing this in French, but yes, I hope it'll be useful. Now, listen, back to Paul's question. It is true that I have had a somewhat roundabout route to come where I am today, but there have always been a few common themes. I've always been interested by international development. I was not an economist as a young student. I tended towards literature. And I don't know if that explains anything except for the fact that I speak Spanish, and I delved into literature. But I really wanted pretty quickly after my first studies to get into economic development in one way or another. And without an economics background, admittedly, that was seen as a bit of a hurdle. Where I found I did have an avenue to come into that space, because I think, Paul, you pointed out that it's not always necessarily your technical direct skill that might open the door. In my case, it was fundraising, because perhaps I have a penchant for writing and a penchant for persuasive writing. I ended up doing fundraising for economic development in a microfinance organization in the United States that worked primarily in Latin America. But what was compelling about that work, which I loved so much, was they, in essence, in the 1990s, were working on a market failure. And that market failure was simply commercial banks didn't have a vehicle or a commercial mindset that would allow them to contemplate micro loans. And I'm talking $50 loans to a group of women in a Guatemalan marketplace. The scale wasn't there. They didn't have the techniques to follow up on loan, et cetera, et cetera. So all the reasons they simply just wrote it off and said, that's not a segment we want to work in. The microfinance revolution, and this wasn't obviously just in Latin America, Grameen Bank and others, what they did is stepped into a void and said, no, there are ways to fill these gaps. You just have to be willing to ask yourself different ways of contemplating a model to get to those customers. And that was a really important lesson for me, because I think that always stayed in the back of my mind. The market can fix failures, but you have to be creative and think outside the box. And that's ultimately one way and another what kind of led me to work in HIV/AIDS treatment in Africa, and then where I've spent the last 18 years developing malaria medicines. In both of those experiences, both in Mozambique with HIV/AIDS treatment scale up, that was 2004. Everyone had said up until then, the market can't possibly supply HIV/AIDS drugs to Africa. It's just too expensive. But that was a lack of creative thinking. And a few good organizations came together to crack that question. And they showed, no, there actually are ways you can make it affordable and feasible to deliver care in sub-Saharan African country like Mozambique with a very high HIV/AIDS prevalence. And then when I came to this current work in a product partnership, so MMV, that middle logo above my head, we develop with partners medicines for malaria, and many of them. We've helped almost 20 drugs we've helped co-develop. That itself was a market failure until the late 1990s. Big Pharma alone was not developing and researching new medicines for malaria, but it took some creative combining of forces to have nonprofit model working with Big Pharma to really refocus science on neglected diseases. And many, many other organizations have been trying to answer that same question for the last 20 years. I think we're answering a market failure. So I'm just going to stop there, Paul, but that's sort of, in a nutshell, how I've been chasing, filling the gaps when the market seems to have failed.
Yeah, I really like that. So what I picked up from what you said, and I like the point that you raised at the beginning, who's in the audience, which is why we do those polls. Out of about 200 people, we have more than 50% women, which is great. Normally we were at 35%. Women are really leading in so many areas, and this is not surprising that we're hitting over 50%. Also youth, people, either students and the ones who are in early careers are about 50% as well. So keeping those in mind, what I heard from what you said is what helps is language skills. You speak French, Spanish, English, maybe a touch of Portuguese, I don't know, but at least three core international languages.
Okay? Portuguese, yep.
Yep, there you go. All right, so that's really helpful, and that makes a big difference. So if you're in Africa and if you're bilingual, great. If you're trilingual, fantastic. Okay, you really open the market. If you're in Europe, almost everyone speaks 3 or 4 languages. Luca, how many languages do you speak?
I also speak 3. Oh.
There you go. All right, and Luca's colleague Daniel speaks 6 languages. All right, so languages make a big difference. And then you talked about other skills, which are I'm not talking about your education background right now. I'm talking about other skills such as how good are you with technology and IT? How good are you with sales, like you said, sales and communication, critical thinking in terms of looking for solutions, and general management, because you went from sales and finance in the Americas to a public health management in Africa, and then product development partnerships dealing with pharmaceutical companies and donors and governments in Geneva. So what I'd like to share with everybody that's here is sort of those transitions that have been taking place and the kind of skill sets that help you get there. So George, thanks for that. And, you know, we've interacted on, when I was at the Global Fund in Geneva, you were at Medicines for Malaria Venture, and was one of the early and rather unique product development partnerships like DNDi, MMV, and there are so many others now. Could you talk more about what MMV is and the kinds of stakeholders it interacts with, and the kinds of people that you may actually let's focus on MMV so people get a sense of what kind of an It's a unique organization. It's not easy to understand. Go ahead.
Yeah. So no, thanks, Paul. We were created at a time in the late 90s when, in hindsight, it seems like it was a beautiful golden period because today doesn't quite feel the same way in the global stage, given some of the dynamics. But it was, on the one hand, MMV was responding to a public health train wreck, really an epidemiological nightmare. And again, it was a failure. It was a failure over many, many years, if not decades, to have kept up with malaria as a huge burden disease that we already knew evolves resistance to treatments. So that eventually, if you keep using the same drugs, you are literally, it's like the expression firing wooden bullets, using ineffective medicines when you have a sick child and they can and will die if you continue using ineffective treatments. It was reaching a crescendo point in the late 90s. MSF doctors, Médecins Sans Frontières, were saying in East Africa, they had 60% failure rates. So a child would come in, diagnosed with malaria, treat them with what they had, and they simply weren't recovering. Incredibly frustrating and obviously tragic for families and losing lives. So why had we gotten there? Because the profit motive that drives a lot of drug research in a conventional pharmaceutical model was not there. Malaria drugs couldn't be priced for profit, not with the target patient group that we were trying to reach. So there was a lot of debate. How can we fix that gap? How can we bring in research to address this market failure? WHO debated becoming a drug development accelerator. TDR is part of WHO. That was a debate. But the funders eventually decided they wanted someone outside of WHO, which is primarily a normative, rule-setting organization, outside of the for-profit industry, because that's where the problem kind of started, but with enough agility and scientific know-how that we could take the best of industry and keep a close ear to the public health population and that WHO represented and fill it. So it's like a triangle, right? We had the public health entities, the private sector, R&D know-how, and then a group that could wed both. MMV then has remained a nonprofit. We have, at this point, hundreds of partnerships, whether it's early scientific, drug discovery, drug development, or drug delivery programs. We've worked with many of the big pharma companies that wanted to do malaria but couldn't do it on their own because their stakeholders, shareholders wouldn't let them spend that kind of money on their own. So we made it possible to bring in some of this know-how. And our own organization, about 115 people, contains scientists, contains access to medicine specialists, which is what my team does. It has regulatory know-how, legal, and business development. We're kind of like a mini pharma company, but we don't make drugs ourselves. We drive drug development through these partnerships, and then we work with the Global Fund, like you said, Paul, and other institutions that help scale up massively how these drugs can get to patients. So the PDP, the Product Development Partnership model, has been replicated for things like DNDi is working on, Chagas disease, sleeping sickness, pediatric HIV. It's a model that has shown, again, if you think a little creatively, whether it's TB or medicines for leishmaniasis, you can bring know-how together in ways that don't always have to fit inside the classic drug development model that corporations have led us to believe, drive most innovation. Doesn't have to be that way. Back to you.
Oh, super. And before I forget, Luca, I think it goes back to the earlier point about the French. Just look into simultaneous translation so that in future we can invite our French-speaking colleagues as well. Even though we're speaking in English, they'll still get to learn and understand what we're talking about. Okay. And same thing for you,
Noted.
Shamli, when we do that. Yep. Thank you. So, let me connect the dots. This goes back to 2004, 2005. And given the audience that's here, many of them were just starting to enter our universe. Okay. So, and a story that they may or may not be aware of. It's a time when our original malaria medicines, chloroquine, which cost 5 cents a treatment, were starting to fail. And in fact, the failing started about a decade earlier, but the new policy came out in 2004 saying that, all right, it's time, I think 2004, 2005, that it's time for countries to switch from a non-working product, an anti-malarial, which was at the time killing several million people across the world, to a more effective product. And then I was part of Global Fund at the time. We said, we'll put some money up there for this activity. We reached out to pharma companies to produce the product. Countries were interested in this, and WHO had changed the policies. The challenge was that there was no central coordinating body that was able to actually bring everyone together. And can you remind me, when was MMV founded?
1999.
Okay, so right around that time, and you guys obviously then played a key role in the introduction of ACTs and chloroquine coming out of all this. But the problems that we faced with were, Global Fund and donors didn't have enough money, because what was 5 cents a treatment became $2 a treatment, number one. Manufacturers, there was one manufacturer that made Coartem, and they could only make 20 million, and we needed 300 million doses. And the country said, we don't have the budget, you don't have the products, so yeah, you've changed the policies, but we can't switch. Okay. Yeah. So it was really that song and dance of working with these different stakeholders, the ones you mentioned, from pharma to donors to countries to policy organizations. And the kinds of, and I want to link it to careers now, the kinds of people that were involved. There were people with a finance background, legal background, R&D background, technology background, research, et cetera, et cetera. So when we enter the space of healthcare, global health, public health, science, we really need people from all different backgrounds. So I just wanted to highlight that for everyone. Yeah. And so coming back to,
and Paul, let me just jump in quickly on that, something that you said, because I'm always conscious when I tell the MMV's story, we're sitting astride so many partnerships that have done much of this work. So I'm always very cautious to remind people that we're not a pharma company and we don't drive this on our own. The partnerships particularly that have been, and I think are going to be even more important, are with national research institutions, regional normative bodies, so regional decision-making bodies and guideline-setting bodies, regional regulatory bodies. It's actually quite exciting, despite the disruptions of the last year in global health architecture and financing. In the meantime, what the last 5-10 years have shown us is great research capacity. And again, my focus is primarily 80% of the world's burden malaria is in Africa. So I think of mainly African research institutions and what I'm about to say, but some great emerging African drug discovery organizations, drug research, so large-scale clinical trials being led by African institutions, and then this exciting new page being turned of African Medicines Agency, not quite being the FDA for all of Africa yet, but they will get there. In the meantime, it is an African-led technical excellence bureau, and you know about them a lot as well, Paul, because you know their founding CEO or executive director. There's so much potential now with this focus of regulatory and Africa CDC playing a continental-wide disease control function. It's totally different today. I'm super excited that compared to 1999, the future looks very much more country-led, and that's great. I mean, I think it will give a lot more sustainability to this kind of addressing market failure without necessarily having Geneva organizations driving the next wave of solutions.
And that's where, about 7 years ago, Africa CDC was founded, taking the lead in that area as well, working with national health institutes, and a lot of interesting positions that have opened up in Africa. In fact, I know Africa CDC has a ton of jobs, African Development Bank and all these areas. So think, and I know I don't mean to focus only on Africa, but the same aspects, the solutions that we're looking for are global solutions, which is why you want to, sometimes when you want to solve issues in lower income countries, you could be doing this out of the Americas, you could be doing this out of Switzerland, or in the country where you're actually focused. So depending on where you are and what you're interested in, think um, whether the kind of work that you want to do is national, regional, or global. And sometimes making the hop to global requires you to go through those incremental steps and requires you to work for the right kinds of organizations and study with the right institutions as well. So let me pivot a little bit. And again, we touched on this, but I want us to go a little bit deeper. Your background is entirely non-health. And you have and I'd like you to expand on that as well. It's management and social sciences or humanitarian liberal arts background, but you are deeply immersed in solving health issues and saving lives. But you work at the same time very closely with doctors, nurses, pharmacists, research associates, research specialists. Do you feel sometimes you don't have the right skill sets? Do you feel like you belong there? Do you feel like an imposter? I mean,
Yeah.
are you in the right place? Did you slip in? I mean, can you talk about that? And is there a real place for people such as who have non-health background in this area?
Yeah, no, it's funny you say that. So yeah, a good question. So why do I not feel like an imposter, but more like someone who respects those areas of expertise you said, but then finds ways to make, the expression 2 + 2 = 5. When you have synergy, like what does it mean to bring together expert functions in a way that if they play together really well, then you get something much bigger. And maybe part of what my role has been as a non-clinician has been to find ways that we bring research, medical, access, supply chain partners together in a way that really can create an end-to-end impact. My father was a very humble but successful businessman who said, always hire people better at what they do than you could ever be. So he was by no means a control freak. He believed you want to get the best people. And the other analogy I use is like an orchestra conductor. You can pick your favorite classical orchestra if you've got one. Think about the person who rehearses that whole orchestra and makes them play. You can be guaranteed there's a better violinist than the conductor. There's a better trombonist. There's a better percussion. The conductor is not there to be better than the musicians. The conductor is there to bring that force together and be humble on the one hand, and also be very driven with a vision about how these pieces come together. I think managerially, that's part of what our business training, Paul and I went to the same graduate school for business education. When I went into hospital administration work just after business school, that's what I realized. There were doctors who knew much more than I would. Some of them even bristled at the fact that they would even have to listen to a non-doctor. But most of them understood that our job in administration was to make it easier for them to do their work better. And I think that's always been in the back of my mind, that in essence, these are kind of our customers, the classical violinist or the classical doctor. These are the ones you want to help them do the most beautiful work they possibly can. That means they need systems supporting them. That means they need financing. That means someone needs to be advocating for their work on a bigger picture. And so individual researchers in malaria have benefited from us making a larger investment case to support malaria research, and then to help coordinate what different research institutions are doing. So I do think of it sort of like conducting a larger orchestra. That is what management does when it does its job well. And I think that sort of has infused the way you and I were both educated in management school. We had a very enlightened approach to management at our graduate school.
Really like the metaphor of being a conductor, and definitely he's not the best in most of those instruments, but he's able to get the best out of them, and it's fantastic. It also, even if one had a health background, I've got a health and a pharmacy background before I went to the business school, although we went there at different times. there will be moments where you are surrounded by people who are more experienced than you are, smarter than you are. But what I'd like to emphasize to the individuals, the youth, as you grow in this space, there is definitely one thing or more that you know or you understand that is unique and that is special that others haven't thought of. And because your background is different, you grew up differently, you thought differently, you had different upbringing. So take those moments, take those chances to explore and express those moments and thoughts in a group, even if you're not sure. And taking those risks, you may not succeed all the time. And sometimes you may say something that's incorrect or people may have a different opinion. I'm not saying incorrect. People may have a different opinion, but I would put yourself out there, take the risk and learn and grow. Because if you don't say what you wanted to say, you'll always wish that you had. So again, that is directly linked with communication skills then. So again, we talked about other skills. Communication is way up there. So whichever language is your native language, practice public speaking, practice group speaking, and of course, bring in critical thinking as well. Let me move on to the next part, which is even more linked with careers. And we've got in terms of the estimate is there's probably 100 million jobs, 100 million people working in the health sector, give or take a few million. There's at least 10 million jobs out there that are unfilled, 10 to 11 as per WHO. And that's what's been calculated, assessed, reviewed. There's probably a lot more. And my question is related to that is, at the same time, we have a situation where there's a lot of disruption going on. Jobs are disappearing with AI coming in, with funders leaving, etc. So while there's a growth in jobs, there's a decline in some other areas. So a lot of changes taking place. What's your insight for people who are planning ahead, thinking ahead, both from a general perspective, what the health sector is looking like, what do you recommend to the others, and anything more specific as well, and bring in any anecdotes that you had as well. And yeah, please stop sharing for the moment. I'd love to hear George. Yeah, thank you.
Yeah. So this is, again, being humble enough to realize the world continues turning, and what people are having to navigate today in a future where AI is either paradise found, hell on earth, or something in between. We've all been hearing very, very varied perceptions around what this is going to do. I guess the one thing we can all be sure about is it will be disruptive. That's not necessarily something that should scare us. I'm sure that when the first automobiles came into position and people who made horse-drawn wagons realized they might not have a job in 20 years, some people figured out that, yeah, but there'll be other things that we'll be doing with that car instead of the horse-drawn wagon. This is obviously a critically transformative time for a lot of what's been business as usual. All of us have been touched by it in some way. We're just beginning to see where the horizons can be for a future where AI is going to be so prevalent in every area of our lives. I guess, the one thing I would encourage us to do is not panic. The best way to think of the future where AI is going to be ubiquitous in our professional lives is it is a monstrously incredible tool. But tools only are as effective as the people who decide how and where they should be deployed. So the intelligence to say, I can use, in the old days, this car, in today's world, this AI, to make work faster, better, higher quality, to help push through new areas better. Embrace this with the most positive mindset possible. A quick anecdote in our organization, I'm sorry to fixate on AI, but I do think it's something we all have to grapple with. In our own organization, the questions across all elements of our work where AI can come in and help us is something we're really diving into as an internal dialogue. For drug discovery, can AI today, drug discovery in the last 10 years meant screening libraries of compounds to try and get a hit that would work for malaria. AI is going to blow the doors off of how we do drug discovery. And we're trying to harvest that to go even faster in the future. On access, how we're going to be planning for drug delivery campaigns, where we have to contemplate shifts in weather, where we're going to have to use different drugs for prevention. All of this AI is going to be like right here on our shoulders, eventually helping us do better delivery, diminish the risks of drugs not being where they need to be, getting the right drugs in the right volumes. So I think we embrace it with an optimistic sense, but we have to embrace it. We have to look at it really critically and ask ourselves, where can we be going much better with this kind of generation of new tools? I think, and I'm not going to stereotype all young people, but I see it with my own children. There's clearly an affinity for people in a certain learning part of their career to readily and easily adapt new technologies better than people in my time, towards the end of their career, where just call it brain plasticity, or I've been doing things a certain way for 30 years. Younger people haven't. And so I think what you said, Paul, about having an open mind, a curious mind, bringing in new ways of asking questions. It's an exciting day to be having this great new force of technology at our fingertips. So I expect people will be answering the question you asked me very differently, because I'll have a different set of younger, fresher eyes, and not be laced with my unconscious biases after 3 decades of doing work a certain way.
As you were speaking, it reminded me of this transformation that you talked about, the horse-drawn carriages, and the cars. And in fact, I think there was still, I'm trying to remember, even a bicycle when it first came out was considered to be a threat, and it was called a mechanical horse initially. They didn't even know what to call it. So it was and same thing with the cars and horse-drawn carriages. But the story that I'd like to share a little bit in terms of when there's complete changes in technology and we think things will come to an end, new doors open, new frontiers open. So like you said, let's not assume that just because there's either AI or the development sector is seeing some funding challenges, what are the other doors that are opening? We know that the health sector is continuing to grow rapidly. It's one of the fastest growing sectors compared to all the others. The global population is aging. So there's no doubt that the health sector will keep expanding. And there's no doubt the number of jobs will keep increasing, both in your country and globally. And there's a movement, there's healthcare migration of jobs as well, with older countries needing younger people as well. And it's happening across Europe, it's happening across continents as well.
Mm-hmm.
But the really interesting example is the Michelin tire company. If some of you are aware of it, it's French originally, it's a global company. And initially when they started, they were, I think they even made some products for horse-drawn carriages. And then when bicycles started to come, they're one of the early ones who came up with tires, but the first ones to come up with inflatable tires, air-based, because otherwise everything was Rubbermaid. And when people were moving with those hard rubber-based tires, it was really uncomfortable. So the first ones to come up with inflatable tires, tubes, etc. And then when the car market came up, they shifted everything to cars, and they really grew and expanded. That led to encourage people to drive more. They came up with the Michelin maps and the Michelin restaurants so that people would go explore some more. So today, the Michelin restaurants are more famous than the Michelin tires. So keeping in mind for people who are working in the health sector, and coming from the non-health background, there's a lot of areas to innovate and to enter from that point of view as well.
Paul, let me make a quick comment on something that you struck this chord in my mind. So obviously, I was very taken the compelling case of infectious disease and the failure of industry to have created right drugs for infectious disease. And this is why malaria was huge in my mind. But, obviously many of you know this because you're living this experience. The last 20 years in many, many countries, in middle income and even lower income countries where we've seen what the future is going to look like, infectious disease will become less and less of the driver of healthcare requirements. Chronic disease, diseases of maybe the middle class, call it, or just diseases of disconnect between healthy lifestyle, access to healthy living and food, and diseases that come from that. So whether we're talking diseases related to respiratory, chronic asthma, diabetes. These are, and I know your experience living in India, Paul Rees, I mean, these are becoming huge public health questions, as they already are in some of the higher income countries. So I do think just watching and understanding what the future is going to require is really, really fascinating. And yeah, imagining 10 and 15 years out. There is one common theme between infectious disease and some of the non-communicable chronic illnesses, which is prevention is still always worth a pound of cure, whether that's avoiding malaria, avoiding HIV, avoiding food products and the risks of diabetes. Prevention and education of prevention will always be something that health architects should be doubly committed to. And maybe we'll have better ways to educate people on that in the future using AI tools or whatever. But yeah, there's one common theme. Even though the disease burden is shifting, we do want to make health a function of preventing illness, not curing, wherever possible.
Indeed. Fantastic. I've also pasted in the chat, but Luca, I can only seem to chat to panelists and hosts. So if you could forward that or put it in the full participant chat, to everyone, that'd be great. And if you can open that for George and I as well, so we can chat directly with participants as well, would be good. And it's called, the movie's called Fire in the Blood. And this is an incredible movie and summary of the fight against HIV/AIDS, going back from late 1990s all the way till it's still going on. That summarizes the challenges and the product development partnerships and how the world came together and how the world came to stop this from happening as well. Because if you were around in the mid 1990s, they had no idea what HIV/AIDS was and what the virus was, and it was just decimating populations. And there were pharma companies who wanted to maintain patents. There were NGOs and civil society and governments that needed to be able to license it. And eventually how the solutions came about, the challenges and what it took. It's a fantastic story. Medicine Sans Frontières was one of the main leaders of putting this together, among others. Please watch the movie. It's free. It'll give you a really fantastic overview of life and public health and help you with your career as well. So with that, and being conscious of time, I'm going to move to a couple of slides that I have, and then which focuses on the career aspects that we've been talking about. And George, amazing to have you as always. We're going to bring you back in a few months to a different crowd and pivot it with a different topic as well. Next slide, please. So take a look at this, all right? One of the few markets that is guaranteed to grow. So if you're interested in the health sector or you're working in the health sector, you're in the right place. Over $9 trillion market, that's at the global level, expected to grow to 12 trillion. What is driving the growth? Aging populations, digital health, AI, climate and pandemics. You can read that slide. And a huge employment ecosystem in all these areas: medicines, nursing, pharmacy, allied health. By the way, allied health has 50 different elements to it, lab sciences. And remember, George has none of these. And the guy managed to create and shape and save lives in ways that are incredible. I've seen his work and I've seen his team's work that he's leading and what MMV is doing as well. So direct health professions and related health professions, there's a huge requirement for you. There's a massive gap. Next slide. We talked about some of these numbers, 11 million jobs. We know there's a shortfall plus some. The other number is even more powerful. 4.5 billion people lacked essential health services, which means there's work to be done. Yes, we're looking at it from an individual point of view. Will I be able to get a job, feed my family, take care of myself? But at the same time, whatever it is, when you enter that space, there is a massive global need of taking care of people as well. 2 billion people face financial hardship or out of pocket. I mean, that's a whole financial aspect of this as well. Could somebody just remove there's a little sign that's showing up that's Zoom related. Next slide, please. So one thing we've known is, and people ask me this anecdotally again and again, which is, hey, I'm studying this, I'm studying that. Should I enter the health sector? Should I not? A lot of questions. What pathways do I choose? What skills should I take on? What should be my next step? What exposure? How do I get an internship? How do what's the right first step or the second step to take? Next. Obviously, to answer that, you have to look at it from what is it that the employers are looking for. And here you have whether your knowledge skills in the health sector and beyond. Data analysis and monitoring and evaluation is a massive gap. There are probably tons of jobs in that whole area within public health for those who are able to respond to that. Project management, communications and partnerships. And you heard from George about fundraising, which is communications, partnerships, proposal writing, and knowing how to move in that direction. Cross-cultural team and languages. Languages we talked about. Cross-cultural, to give you a sense, and again, through I didn't plan it, it just happened. I grew up in India for the first decade of my life. My parents moved to England. I spent the next several years in England, went to high school there. They then decided to move to Africa. So I grew up in Africa as well, spent lots of years there. In fact, my parents still live in Africa, in Nigeria. I went to the United States for my education and work, and I was there for 20 years until I joined the UN system and came to Geneva. So that cross-cultural experience, you drop me anywhere, I feel comfortable. George, you heard from him, started off in the Americas, went to Mozambique, now in Europe, and you haven't heard half of what he's done as well. So even within your own country, even within your own city, you will meet people who are cross-cultural. Take the opportunity to learn them, get to know them. Next slide. And depending on where you are in your growth career, whether it's entry level, mid-level, senior level, you've just graduated. Obviously, you're looking at entry level, different kinds of organizations, the INGOs, NGOs, foundations, pharmaceutical companies. There are different sects and segments that you can look at. Try to know what you're interested in, and then focus and really deeply research in those areas. My son, at the age of 14, knew he wanted to go into music. Totally unrelated. But he knew at the age of 14 that that's what he's going to do. And what I asked him was, hey, what if you don't succeed? What's your plan B? He said, more music. So since the age of 14, that's what he's been focused on. After high school, when he finished his day, he would spend 3 hours doing that. And ever since then, he's been doing the same thing. He's 21 now, and he has to find his way. He will go through the entry level, mid-level, senior level. But if you know what you want and you're dedicated, you will succeed. You will get there. Just learn and understand as much as you can and get the new skills that you will need. Next. So to help and formalize some of this, the guidances, suggestions that our faculty members and I have been given, we teamed up with UNITAR, our longtime partner in Geneva, and we've done several of these types of workshops, is bring youth from all over the world, from the Americas, from Europe, Africa, Asia, to Geneva, and create this 5-day immersive workshop. The workshop, which will be done in the UN Palais, in the UN building, will have global experts, real-world exposure, talk about career pathways. There'll be site visits to WHO, to hospitals, to various organizations, and there are world-leading organizations. We'll go to MMV, you heard from George. There's the Global Fund and others. So we've curated and created the whole environment. So if this is something of interest, next slide, please. Oh, sorry, it's on August. Sorry, go back. If you look at the date, it's 3 months away, almost 3 months away. You can plan. You can already start planning if this is something of interest to you. Actually, June, July, August, 2 months away. And I would reach out to the folks. Next slide. Yeah. So this was students. We're targeting students and young professionals to really guide them. We already highlighted this. Next slide. These are the kinds of focus areas that we're working on to explore your pathway. And they broadly would fit in all of those 4 or 5 areas. And building employer-ready skills and taking action at the event. So look at number 3, the box number 3. We're focused on building experience, tailoring your profile, helping you network, stay globally connected. There'll be people from human directors of HR, from the UN agencies, from universities, from companies that will talk about how they hire, what kind of people they hire, so you learn and understand from there. So really career development for experts as well. Next slide. We'll share the details. Please put it in the chat, and then people can dig into it more deeply. And there's a whole focus before the workshop, during the workshop, those 5 days, and continued support for 3 months after the workshop as well. Next slide. Speakers, workshops, and the contact details are there. You've got Shamli, Daniel, and Luca. 2 of them are already here. And the price point as well, it's a discounted price for those who are able to make it. And we're really encouraging at least 50% participation from women as well. All right, next. All right, so let's stop sharing the presentation. Request people to type away their questions so that we can, George and I, and of course, Luca and Shamli. By the way, both Shamli and Luca represent, and we learn from them in terms of understanding what, as youth working in the health sector, what they would like to see. So it's not, we're not cooking up something as people who are several generations away, but we bring our generational experience to the youth. And Luca and team and his colleagues, Mara, Daniel, and others are guiding us in terms of what it is that we should be thinking about more and more. Okay. So George, if you see any questions that you could respond to, Luca, Shamli, please scroll through.
Yeah, so just I've seen a number of questions about internship opportunities at MMV. Right now, we've been fairly constrained on the ability to run large-scale internship programs. Periodically, and particularly in the research and development functions, We have done a fellowship type programs. These are normally linked to some of the African research institutions we work with. So we don't have it at scale on a recurrent large scale basis yet. We'd like to get there. In all likelihood, to do that at scale, we will be partnered with a few leading African research institutions that can also help a lot with the question of the right screening, the right filtering in on what the most productive kind of scholarships will be. So I don't at this point have a way to do that. I would say that if there are specific areas of interest in malaria, depending on your countries, we can probably point you to some really excellent organizations in at least 10, maybe even 15 partner countries where there's some great work going on. And whether it's vaccines or vector control or drug development, there are some hot spots to be identified. So we could take that offline and maybe come back with an information blast about where those would be.
Thank you for that. There's another one. There's a gentleman, maybe a man or a woman, I'm not sure. It says, I'm an young African graduate in vaccine manufacturing and looking for a career in the field. We may have, and I'm not sure if he's looking for, doesn't say internship, but please reach out to us. It's an area that we're very active in, and Empower focuses on training, skill, and capacity building. And one of the areas that we work on the education side, but also strengthening the workforce linked with manufacturing, linked with regulatory, linked with supply chain. So please reach out to us, send your CV, and we'll look at that. There's also a question for you about, is there a vaccine for adult malaria in the upcoming year from Sudan, et cetera, et cetera. If you could just take a look at that one.
In our Q&A, correct?
Yes, yes. It's about halfway down.
So I've been going up and down these. Is there any vaccine for
Nasreen Saleh.
Yeah. Thank you. No, thank you for that question. Very quickly, it's a good question and a complex one. The short answer is vaccination right now for malaria is in the early stages of rollout, as you probably are alluding to in your question. And no, the vaccinations that have been, there's two that have come through in the last 5 years, one about 2 years ago and the first one about 5 years ago. They're both intended for children in the first year of life with a booster in the second year of life. And the protection is unfortunately not a lifetime protection. It lasts for, we hope, the first 2 to 3 years of life, and potentially there'll be boosters up to the age of 5. So vaccination for now, there's research being done for a second generation of malaria vaccines, which could be used in older populations, potentially population-wide vaccination, but that is still realistically several years away. So vaccination today for malaria is very much a child protective strategy, and it really is kids under 5.
Thank you. There's a gentleman, or sorry, I keep saying gentleman. There's a 50% chance I'm wrong. Okay. There's an individual from Myanmar who's got a community health background, a bachelor's degree, wants to study a master's degree, has some challenges with university-related transcripts. Team Luca and Shamli, please coordinate, reach out to this gentleman. Yes, we can definitely find a solution in this area, depending on your area of interest. Another person who would like to consider a career with WHO. Let me give you one rather pessimistic set of news. A very large number of thousands of people from WHO and other UN agencies working in health have been let go because of significant reduction in funding. Trying to get a job in WHO at this time, whether it's short, whether it's a fixed term or part-time, is going to be extremely difficult, number one. Unless you are offering something unique that WHO needs, and they are looking at specific areas. They're not, the overall organization is shrinking, but there are specific departments and divisions that are growing as they're coming up. They may be in climate health or digital health, etc. So keep in mind the macro environment where UN agencies overall are struggling, but at the same time, if you have a specific skill set, then you could indeed look into applying for those. And in many cases, they would be posting those. They have to legally and officially post those positions as well. And could I ask, I think there might be quite a few questions in the chat as well, and I request the faculty members to look into that after we're done with the Q&A. We can quickly run into that. And we can spend another, we're good for another 10, 15 minutes. So if those who would like to stay, we can run through the questions and answer them. Okay. George, let me give you the floor, and then I'll also give the floor to Doctors Harpreet, Shamli, and to Luca, in case you see a question that you would like to respond to.
Great. You know, I've been combing up and down a lot of really good questions, and many, unfortunately, I don't have the right answer to, or any answer to at this point yet. Obviously, there's some questions coming up about the specific education opportunity that you described, Paul, and your team can look at those. I guess you'll have a way to get back to people after the call hangs up. Is that correct? You'll have, when people registered, you do have ways to go back on specific questions regarding the training, I'm guessing.
That's all right. I'll also
Yeah.
paste my email and a couple other ones in the chat in a sec. I'm just
Great.
formatting
All right.
the message right now.
That's good. So many of those will be picked up. And look, and the other thing
Luca,
I would say,
sorry to interrupt, George. Luca, because in most cases, it says, several cases, it says anonymous attendee. Are you still able to reach them?
Yeah, we have the information in the background.
Okay.
Yeah.
All right.
yeah, on the Q&A,
It's
it
just
looks
for the
anonymous
others that they
often,
don't
but it
see
looks
it.
like the chat doesn't. So no, and I
Yes.
guess the other thing is, one thing that's very different in the world today since COVID, what we're doing right here, right now, and many of you probably do this a few times a week, the opportunities for virtual workshops or information sessions, I think, is remarkable. I think it's been explosive since COVID, and so yeah, I'm definitely a fan of being able to do short-term trainings, information sessions. You can harvest a lot of information as well through pre-recorded materials. And it just occurs to me that we probably can do an even better job of chronicling some of the information that MMV does in a way that is prepackaged. We do have a website. It describes our work, but in terms of educational materials, take a look at some of the things we have for very specific areas of malaria. But I think many other organizations have gotten much better as well since COVID about putting a lot of documentation online, given this virtual space that we're in right here. But yeah.
Thank you, George.
Anybody
Any other
else?
questions in the chat?
Yes, we will be sharing the presentation, so we'll make sure that it's available. What is the possibility of a public health specialist fitting the One Health ecosystem? You have exactly the right background. Okay. Public health people are desperately needed, and One Health ecosystem is still being shaped and developed and better understood. But what you need to do is then sit at the middle, because there's veterinary, there's climate, there's public health. There are so many elements to it that, and it's one of the areas that we've been asked to look at least start with some free short certificate courses to give you a sense. But go to Coursera. Coursera is one of our leading partners that offers a lot of free education. And there'll be others as well. Go to the WHO website. learn about the One Health ecosystem. It is what the world needs. So good choice, continue there.
So there is this one question in the chat from Fatma. So she's a graduate from veterinary sciences and she is asking the relevance of digital health. So Fatima, I would like to help you with the response on that. So your veterinary medicine background is a strong asset. Like we know when, Professor Lalwani mentioned, through the One Health approach, veterinarians they can contribute to public health, disease surveillance, and outbreak prevention. And by developing skills through digital health, you can definitely contribute in data analytics, epidemiology, or even health informatics. So your background will definitely, be a very important key offering to offer digital solutions in improvement for both animal and human health outcomes. Thank you.
Very good. And in fact, somebody reached out to me looking for a veterinary scientist with some years of experience in Nigeria for a consultancy job. So if anyone over here knows of people with veterinary background and management background, please let us know. There's something out there for you.
All right. If there's no more other questions, I suggest we open the end of session polls to figure out how we did. Thank you, George. Thank you, Paul, for your very inspiring session and for the great Q&A session. Before we wrap up, exactly as I said, we'd like to take a quick moment to open the polls up for this session. I'll do that right now. And again, as last time, I'd say 2 to 3 minutes just to fill in a couple of these short questions, 7 of them. Thank you very much, guys. Give this another half a minute, and then we'll have some closing remarks as well. Thank you. Great. Thank you all for participating. I'll end the poll at this point. I'll just share the results with you. So it's great to see some great results here. 59% saying that they've significantly improved their understanding of the educational pathways, skills and development, and career preparation due to this session. Great to see. 30% say moderately improved, and with 11% saying slightly improved. We'll be working on that in the future. Rate your understanding of internships, fellowships, and networking opportunities. Significantly improved, 54%, moderately 31%. Great to see, guys. Thank you very much. Great to see this feedback. Rate your understanding of career opportunities in public and private sector organizations after the session. Again, 48% and 39%. Great to see. Thank you. And the relevance of the contents to your academic, professional, career interests, 65% and 29% moderately relevant. Amazing. Great to see. Well, with that being said, I'll be opening the floor up to any last remarks that any of you guys will have. Paul, George, Dr. Shamli, Dr. Harpit, anything you guys would like to share at the end?
More of a question, Luca and Shamli. There's some, we didn't get to all the questions. We didn't answer all the questions, and there's some really good ones, and also in the chat. My question is this something we can continue doing offline?
Yes, so I shared my email and Dr. Shamli's email in the chat as well. It's a couple messages up. I'll be resharing mine as well right now. Any inquiries, please feel free to reach out. I'm always online, also on the weekends, for anything that you guys might need or information. Also in regards to the upcoming workshop that's coming up. Please feel free to reach out, and we'll be coming back to you with the recordings, any material that was used during the session, as well as if you voted that you would like some more information or that you would like to participate in the workshop, we'll also be coming back to you with that information. Exactly. Thank you.
Brilliant.
Well, with that being said, if nobody else has anything, any final remarks from your side? Perfect. Okay.
Very good.
Well then, let's wrap this up. With that, I'd like to extend another heartfelt thank you for all the speakers and of course all those of you who joined us today. I hope the session was informative, and you will be hearing from us very, very soon. Thank you very much.
Thank you,
Thanks, everybody.
organizers.
Thank you so
Thank you very
participants.
much. Thank you very much.
Thank you, Mr.
Participation.
George.